And we are rolling. Hi, Gina.
Hi, Mark. How are you?
Good. So this is Mark Goldberg with you on Dispatch, speaking with.
Gina Moore with BuzzFeed.
And actually, where am I reaching you? Are you in Nairobi?
I'm not. Actually, I happen to be in Sancerre, France.
Ooh,
Yes, la la.
that sounds pleasant.
It is pleasant.
So we're going to talk about a lot of unpleasant things. Sorry, everyone.
It happens.
Namely, Ebola.
Yeah.
And you just returned from a trip to Liberia. Actually, when were you in Liberia?
I was in Liberia. What were the dates? I was in Liberia until about the 20th of August, and I was there for about a week. Whatever that means.
Yeah. And so I read most, I think, all of your reports from Liberia, and they were among the most important reporting on the Ebola outbreak that
Thank
I've
you.
read so far. And one of my big takeaways from reading your reports was that in many ways it seems that the fear of Ebola is more consequential to the health and welfare of the people of Liberia and probably the people in other Ebola affected countries as well, than the actual virus itself. And I'm wondering if you agree with that assessment.
Yeah, I think so. I certainly think that the fear of the disease is shaping everything about the reality in Liberia right now. And it's also true that in terms of sort of population reach, while the outbreak is the biggest in the world, the biggest that the world has ever seen of Ebola, while it's the first in West Africa, and it's terribly deadly and a horrible thing to not to minimize it in any way, but it affects a small portion of the population. Um,
We're talking about hundreds of people in Liberia who have succumbed to the disease, not like
right,
tens of thousands.
right, several hundreds, but yes, not tens of thousands. And there is beginning to be, I think, some more awareness than there was of how the disease is transmitted, how to avoid catching it, even if you are exposed to it. And by exposed, I mean if you are living in the same household as someone who has the disease and is symptomatic or has the disease and dies of it. But certainly the fear of it has really gripped everything about reality in Liberia. There are no schools. All the schools are closed. All the government offices are closed. Most of the health centers are closed to any kind of illness at all, including things that generally affect and sometimes kill far more people than Ebola does, especially in the rainy season.
Well, that's
Um,
exactly, I think, that one of the big points that I drew from your article about the shuttering of a maternity ward in a hospital in Monrovia was precisely that, this hospital is closed because of a fear of Ebola, but in the meantime, women were dying from complications of pregnancy that possibly they might not otherwise have died from had they been able to reach this hospital, right?
That's right, and it's not just that one particular hospital. The hospital that was in the piece was Redemption Hospital, the maternity ward at the JFK Memorial Hospital, which is the biggest one in the country, was closed. Other health centers where they deliver babies a lot of the time were closed, and in that particular case, the one that I wrote about at the top of that piece, private clinics that were open sort of to see patients and maybe sell them aspirin weren't able to deal with some of the complicated problems that came up. And pregnancy is just one example of some of the complications or health issues that many people are having that are fairly banal, so to say, relative to everyday existence, that are really becoming mortal in a way that they wouldn't have been last year at this time.
And Liberia has one of the highest maternal mortality rates in the world already. So if you're putting up more barriers to access to care, it seems that it's not. I don't think it's too far fetched to speculate that is if this drags on much longer, maybe more women will probably die from complications from pregnancy than from Ebola.
It's possible, although a great number of the people who are dying of Ebola are women. So that, I mean, if one is to sort of, roll out the numbers in a speculative fashion, there'd probably be some adjustments to make for that, for the gender burden of the disease. But it's also important to say that while a lot of health centers are still closed, there are places that are trying to open, trying to offer services, trying to stay open. JFK's maternity ward opened again 2 weeks ago, and this hospital had closed because its top doctor died of Ebola, contracting Ebola from a patient that no one knew was positive. And this is a story that repeats in a lot of health facilities in Liberia. So there really was, while I think the effects of this are still being felt, and there are a lot of clinics and health centers that are still closed, there was a sort of, this all comes out of a particular moment where suddenly this Ebola crisis really infiltrated hospitals in a way that people weren't expecting, weren't entirely prepared for. And the reaction at facility after facility was to sort of shut down, completely hit reset, and figure out what to do next. And in some cases, what to do next has been to reopen in limited ways. So JFK, for instance, where Liberia's sort of best known physician at all had been practicing and had contracted and died of Ebola, reopened with its maternity ward, reopening first, and for emergency cases. Now, it's still a very quiet place. There aren't tons and tons of patients coming in, but the morning that I was there were about 40 women who were typically clients of that hospital who were there for their usual prenatal exams, which also shows you, I think, that people, while they're afraid, and I'm talking of ordinary Liberians now, while they're afraid and nervous about the disease and also about health centers, because that's an incubation spot for the disease, or has been, they also know what they need, and they'd like to be able to get it in terms of healthcare.
Mm-hmm. And this, what you describe, I think, speaks to something that I'm sort of deeply, fearful about for the people of Liberia. And I've been to some of the hospitals you mentioned. I've been to the JFK Hospital and Redemption Hospital on various reporting trips, and it's worth pointing out that it kind of goes without saying that these are very rudimentary hospitals, by Western standards, right? That these are basically buildings with beds and some equipment. Nothing at all, like you or I in the West would consider a hospital. That just sort of speaks to the fragility of Liberia's health system in general before the Ebola outbreak. And now it seems like one of my, deepest concerns is that, or I should say one of the key questions I have about the Ebola outbreak going forward is whether or not the health system will totally collapse before Ebola is brought under control, or whether Ebola can be brought under control before the health system totally collapses. Do you think I'm being hyperbolic at all, or how do you foresee this playing out?
Well, part of me is always reluctant to have conversations, especially in moments like this that seem to involve a bit of global panic about realities. To say, oh, what we're talking about could be the total collapse of X, right? Because the fact of the matter is that the system is not working. Whether you call that a collapse or not, I guess is sort of in the eye of the beholder. But certainly there are by and large not health centers for people to go to when they have general ordinary health problems. It's difficult to find some medicines in Liberia. Part of that is maybe a run on some kinds of medicine. Part of that is there are no more flights to Liberia, by and large. There are still some flights to Liberia, but nothing like there was before, which affects supply chains and movement of goods and people and experts and all these things. So everything about this panic, both the sort of real threat and the imagined panic, has lots and lots of ripple effects on the health system and sort of reality more broadly. But I also think that it is true that in terms of Ebola specifically, the health system cannot deal. And I'm not speaking just of the Liberian health system, which of course was ill-prepared to deal with a threat that it had never seen before. It's no surprise that doctors didn't know what they were dealing with because the disease had never appeared in West Africa, let alone in Liberia before. But even Doctors Without Borders yesterday issued a statement saying, hey, guys, we can't do all this on our own. This is not working. The international community is not here for this country in a real way. And if we're serious about getting this under control, more needs to be done, both, internally inside the country with the limitations they now face and the restraints they now face because of the disease, and globally.
So you mentioned a really important issue, which is flights in and out of Liberia, and also I should say in and out of Sierra Leone, and to a lesser extent Guinea. How did you get to Liberia?
I flew to Liberia from Nairobi on Kenya Airways, and at the time I flew, Kenya Airways was insisting that it would never shut its flights down. It was totally comfortable flying, and I happened to do a lot of reporting, only a very tiny slice of which ever made it into one of the stories I did about Ebola before I went to Liberia. I had done several. About this whole airline phenomenon, right? This idea that, oh my God, why wouldn't you shut flights down from these places? Because obviously Ebola passengers can get on a plane and that's terrifying. And the risk of that happening is so infinitesimally small that all the experts had long been saying, we really don't need to make a whole lot of flight pattern adjustments. We don't need to be talking about closing airports, all of these things. And there's the way there's a UN body for everything, basically. There's a civilian aviation UN sort of organizing body that has a subcommittee that deals with public health threats and emerging diseases. That has fantastic experts on how to respond to these things. What to do if you're Air France and you fly to Hong Kong in the middle of SARS, for example, right? People have thought about this, and there are protocols in place. And there are some very good protocols in place for how to deal with a disease like Ebola that, compared to something like SARS, which is airborne, is much less risky in a sort of contained airplane environment.
Yeah.
And everyone had been saying, look, this is okay, this is manageable, we can do this. But the fear that's engendered in the populations that read the news and that kind of thing was just astronomical. I don't know if you remember this moment, but it was probably early-ish August, maybe the first sort of full week of August. Everyone in the world was getting an Ebola test if they'd been anywhere near Africa or had thought about it. And they happened to get a little bit of fever. There were some people who'd been in Sierra Leone and in Guinea and Nigeria who went back to Europe and said, oh, I don't feel so well, can I please get a test? There was one guy I read about in Birmingham in the UK who'd been in Benin and transferred through Charles de Gaulle and said, oh my God, I need an Ebola test. That's the level of panic that people had. That story is very similar to a lot of stories, made the news. And so that kind of thing sets in people's mind. And we saw a similar thing in the press in Kenya where I live. Oh my God, someone from Hong Kong came through Kenya. Did they have Ebola or not? Oh my God, who from Liberia has come to Kenya recently? And so what happened eventually was that Kenya Airways was under too much pressure from members of parliament about continuing to operate, and so they suspended operations. That's just one story about one airline.
Well, and it's manifesting itself on the big international airlines based in Europe, right? So Air France just yesterday suspended its flights to Sierra Leone. British Airways, which has this I think it's a Heathrow, Conakry to Monrovia route that I took, suspended their flight a long time ago. Mm-hmm. I think there's one single solitary airline, Royal Air Morocco, that still continues to travel to the region uninterrupted.
SN Brussels. SN Brussels also flies to Monrovia, at least as of a week ago.
Well, so this brings up an interesting point. So one of the most important human beings on the planet responsible for the containment of the outbreak of Ebola, Dr. Thomas Frieden, the head of the U.S. Centers for Disease Control, had his Brussels Airways flight canceled to Sierra Leone last week and had his trip delayed.
Yeah, I don't actually know a whole lot about what's going on internally at Brussels Airways because originally my flight out of Liberia was also on Brussels and there was all kinds of commotion and then there were no flights available. Mm-hmm. And so I think it might be a demand issue actually, because the irony being there are fewer and fewer and fewer airlines and more people from not, journalism, but also public health, NGOs, this whole world of response that need to get commercial flights to these places. So there's this strange thing going on in this sort of ticket marketplace too.
Mm-hmm. Well, this was the head of the CDC who had his flight canceled to Sierra Leone on Monday when he was trying to make a trip to the region to help organize a response. And you've heard the top UN official dealing with the coordination of the UN system in dealing with the Ebola outbreak, saying basically, do not cancel your flights. As you said earlier, there's an infinitesimal chance of contracting and spreading Ebola via airlines. And by canceling flights, you're making our job, the job of containing the outbreak, much, much more difficult. And it's also, undermining, the long slog of economic development and, that the people of Liberia and these countries have been, you know, have been undergoing since the end of the Civil War. And I wanted to actually take this moment to transition and maybe just kind of give people a brief history of Sierra Leone, maybe, and sort of put this Ebola outbreak into the context of that history. You are in a much better position to do it than I. But suffice it to say, a civil war ended in about 2003, right?
Yeah. Liberia. We're speaking of
Yeah,
Liberia.
in Liberia, yeah. The Civil War ended in Liberia in 2003. Ellen Johnson Sirleaf, Africa's first female head of state, is president, has been president, Nobel laureate. And things have been, steadily improving in Liberia since then in terms of like security and economic development. Why don't you sort of take it from here?
Sure. I mean, I am in no way any more of an expert on this than you are. Probably you may even know more about it than I do. But
Probably not.
we can debate the merits of our ignorance afterwards, or the extent of our ignorance, not the merits. But certainly since the end of the Civil War, Liberia has been trying to climb back to a competitive space, you might say, but that may even be overstating it. I mean, something resembling sort of stability, right? And the security issues, and Liberia is not unique in this regard from any other post-conflict country, whether in Africa or otherwise. The first concern is security, day-to-day security of communities, of homes, of individuals. And that takes some time. That always takes some time to happen anywhere. And then after that, you can sort of see a place moving on to kind of the next step. Sierra Leone, similarly, was in a situation of war, actually a war that spilled over into Sierra Leone from Liberia. And so they do have this in common. And you could see, even 4 or 5 years ago, both countries really sort of arriving at a sort of next step of being able to tackle the challenges of fighting poverty, building basic infrastructure, offering basic services. This certainly it has put a dent in that. Not I don't think, not primarily, let's say that, not primarily because the airline disruption, foils the economies and that sort of thing, which can be true. But I think more because the response in both countries to this crisis has been a full-on halt to everything. There is no such thing as business as usual in Liberia right now. There is no such thing as business as usual, from what I understand, in Sierra Leone right now. Basic movements inside the country are restricted. Counties are quarantined. In Monrovia, there are parts of the city that are quarantined. And that's all sort of in the name of trying to make sure the disease doesn't spread. But that also means no one is doing anything else. All the ministries in Liberia are closed. And when I was there, the president had issued a plea, and there were all these pleas on the radio all the time, for people who worked for the government basically to loan their cars back to the government for Ebola response. Certainly the need for vehicles was huge. I mean, this is really the only thing that anyone is doing right now. And that kind of single-minded focus, while hopefully helps fight the disease, certainly makes it difficult to run a country in any semblance of the word in any other way.
And I know the African Development Bank put out this report this week, saying that the economic toll of the Ebola outbreak could be just devastating in terms of like lost foreign investment and also lost productivity, based on sort of the fear and sort of, as you said, the halting of business as usual. And at least like from a UN perspective, both Liberia and Sierra Leone are seen as something of a success story, because it wasn't that long ago, 10, 15 years ago, that these two countries were like the epicenter, were arguably like the most horrific places on the planet, with just a brutal civil war full of like all of the sort of worst imagery you can imagine, mutilated limbs and rampant sexual violence. But now here we are, 15 years later, and at least in Sierra Leone, there was a peacekeeping mission there that that didn't need to be there anymore, so they transitioned out, and that's like the ultimate success for UN peacekeeping is if they can actually leave a country in the hands of local authorities, which they were able to successfully do last year. In Liberia, there's still a peacekeeping mission, though it's smaller and its like role is no longer kind of that day-to-day security stuff. So in both instances, like you said, I mean these were two countries that were all pointed in the right direction, and the Ebola outbreak has sort of seemingly seems to threaten to halt that progress.
Yeah, or at least it's a coda to progress or to some progress, right? I mean, you're right about, obviously, you're right about everything you've just said in terms of progress that's been made, and yeah, drawing down of the UN peacekeeping mission in Sierra Leone, peace building mission in Sierra Leone, was a fairly big deal in terms of Sierra Leone's own moments in history. Certainly, a drawdown of the peacekeeping mission in Liberia would be similarly celebrated, I think, both inside and outside Liberia. But these are also countries with some significant challenges too, right? There's a fair degree of foreign investment in Liberia. Liberia is not resource poor. It has things people want. It has timber. It has rubber. It has land being cleared for palm oil plantations. It has a lot of reasons that folks might want to come and invest some money. And most of the time, people who are looking to make major investments in emerging markets take long views. And, even the UN thinking about airlines has taken a long view of what's going on in West Africa. I don't know that we know yet that Ebola is going to stymie the economic growth, the macroeconomic growth of these countries in the way that a lot of doomsayers are saying. It could go either way. I mean, I'm not an expert. I'm just saying that I don't think we know that that's true yet. And I think it is probably still a little too early to have much confidence about that. I do think something that we know is true is that Liberia, in any event, is a challenged country, but also a fairly corrupt country. There's been a rather sizable sum of foreign dollars invested as aid or as bilateral donor money into, for example, the health sector in Liberia. And you could visit in 2009 and you could visit in 2012, as I did, and not necessarily see a whole lot of change. And I think now when people look at what's going on in Liberia, there are a lot of hard questions also being asked about that. Wait. Not that money would have helped prepare you for Ebola, but hey, where exactly did all that money go? Now's not necessarily the time to get distracted by those questions. I mean only to suggest that this is not really, only a story of countries on a rosy path toward progress, and now, oh no, there's this distraction. You can see in Liberia, in this sort of day-to-day of conversation, the political manipulation of variations of those narratives, right? And on the other side, too, you can see people manipulating the Ebola story to sort of try and undermine the president or her administration as well. I mean, only to suggest that it's a very complicated reality, and whichever thread you happen to pick up of it has political resonance on one side or another.
Well, Gina, I think we'll have to leave it there. Thank you so much, and again, I encourage everyone out there to read your reporting from Liberia. It was just some of the best out there in terms of offering some context to the how the outbreak is affecting local communities. So thank you for that.
Thank you. Thanks for reading. And
Okay.
thanks for having me do this.
All
Always
right.
nice to talk to you.